Have you ever wondered why your eye doctor always asks if you have a cat at home? Or maybe you've noticed a strange shadow in your vision that wasn't there before. Well, there's a parasitic infection that affects over 2 billion people worldwide, and many don't even know they have it. That infection is called ocular toxoplasmosis, and today, we're going to break down exactly what it is, how you get it, and what it means for your vision. Before we dive into the details, let me explain something interesting. Ocular toxoplasmosis is caused by a parasite called Toxoplasma gondii, which is a single-celled organism that's actually one of the most successful parasites on the planet. The reason it's so successful is because it has a clever strategy to spread. It can only reproduce sexually inside cats, but it can survive in almost any warm-blooded animal, including humans and you. So here's how the infection typically starts. You could get toxoplasmosis by eating undercooked meat that contains the parasite cysts. Alternatively, you could accidentally ingest it through contaminated water or dirt, or even from handling a cat's litter box without washing your hands afterward. Many people get infected this way without ever developing any symptoms at all. In fact, about 1 in 3 people globally are infected with Toxoplasma gondii, but most never experience any problems in their eyes. However, if the parasite somehow makes its way to your eyes, that's when ocular toxoplasmosis develops. This condition is unique because the infection typically attacks the retina, which is the light-sensitive tissue at the back of your eye that captures images and sends them to your brain. When the parasite inflames your retina, it creates a lesion, or in simpler terms, a scar-like spot of dead tissue. The fascinating thing about ocular toxoplasmosis is that most cases are actually reactivations of old infections. This means you were infected years or even decades ago, but the parasite went dormant inside your eye tissue. Then, when your immune system becomes weakened for any reason, the parasite wakes up and starts attacking your retina again. This is why people with HIV or AIDS are at much higher risk of developing active ocular toxoplasmosis. Now let's talk about the symptoms you should watch for. Many people with ocular toxoplasmosis experience floaters, which are tiny spots that drift across your field of vision. You might also notice a shadow or dark spot in your vision, especially if the lesion is in your central visual field. Some people experience blurred or distorted vision, and in more serious cases, you might notice flashing lights or even temporary vision loss. If you're experiencing any of these symptoms, it's crucial to see an eye doctor right away because early detection can prevent permanent vision damage. When your eye doctor examines you, they'll use a special magnifying lens called an ophthalmoscope to look at the back of your eye. If ocular toxoplasmosis is present, they'll see a characteristic white lesion on your retina, and often there's inflammation in the vitreous, which is the gel-like substance that fills your eye. Sometimes the doctor might also see a scar from a previous infection, which confirms that you've had this condition before. Here's where it gets interesting. Not every case of ocular toxoplasmosis needs treatment. If the lesion isn't threatening your central vision and your eye isn't severely inflamed, your doctor might recommend observation instead. However, if the infection is active and threatening your sight, several treatment options are available. The most common treatments include antibiotics like sulfadiazine or azithromycin, which kill the parasite. Doctors often combine these with corticosteroids to reduce inflammation and protect your vision. The good news is that with proper treatment, most cases of ocular toxoplasmosis respond well. However, some people experience permanent vision loss if the lesion is large or located in the center of the retina. The infection can also lead to other complications like secondary glaucoma, which increases eye pressure and damages the optic nerve. So how do you prevent ocular toxoplasmosis in the first place? If you don't have the infection, avoid eating undercooked meat, wash your hands after gardening or handling soil, and be careful with cat litter boxes. If you're already infected but healthy, there's no need for treatment. But if your immune system becomes compromised, talk to your doctor about preventive medication. If you found this video helpful and you want to learn about more eye conditions, please subscribe to the channel and hit that notification bell.